Okay, so good afternoon everyone. So I hope no na nabusog kayo sa inyong lunch. So today we will now proceed sa ating another topic which is our IV therapy. So before I will start, may I ask if Mr. Gasto Christian, if you have any idea ano ang IV therapy? Mr. Gasto.
Um, Hello po. For me,
Hello.
IV therapy, or what we call intravenous therapy, is like a way for us to give fluids, medicine, or nutrition, or blood directly to our patient, or to the bloodstream, or the into the bloodstream through a vein to our patient.
Okay, so very good, Mr. Gesto. So tama yung sinabi niya, no? So, next slide po. So we will discuss what is intravenous therapy. So when we say intravenous therapy, we have to mind the word that this is an aseptic administration of delivering mga nutrients, of fluids, electrolytes, medications, and also hydrations directly sa ating circulation for instantaneous na absorption and usage ng ating body. So it is known as IV therapy or again, intravenous therapy. So this is given via the venous route and this is a dependent nursing action. So hindi tayo pwede magbigay-bigay lang ng IV therapy na walang order ni doctor. Next po, please. So, what are the purposes of IV therapy? So first, this is para mag-administer tayo ng fluids, nutrients, and chemical substances when there are circumstances no, na ang ating mga patients is hindi sila able na makakonsume ng normal diet or hindi sila able na makabigay ng or hindi sila able na makainom ng mga oral liquids. So for example niyan is hindi sila makakain for an extended period of time so they can meet their nutritional needs with total parental nutrition. So example niyan is yung mga patients natin wala po that are placed on NPO. So next is to replace fluids and chemical substances when patients has experienced loss. So for example, for patients who are suffering from um, vomiting, diarrhea, so ganyan, in order for them to meet their nutritional needs, so nagabigay tayo ng IV therapy. So this is para mag-maintain tayo ng ating homeostasis pag insufficient or ating nire-replace again yung additional loss. So next, this is to provide access sa ating circulatory system if it becomes necessary to administer emergency medications. And last is to maintain natin access pa rin sa circulatory system for the intermittent administration of scheduled medication. So next, please. So we have IV fluids. So itong mga IV fluids natin, ito yung ating binibigay sa ating patients na mga solution. So mostly no, ang ating makikita nito sa hospital, ang color niya is clear, but there are also na hindi clear yung color nila. So it can come in either glass mana bottle or plastic bags pero with various sizes, pero usually ang nakikita natin sa hospital is yung mga plastic bags. So before man tayo mag-go on sa ating types of IV fluids according to sa kanyang tonicity, so I have 3 things for you to know or to remember para mas maintindihan natin how does these types of IV fluids differ from each other or how does these types of IV fluids works sa ating body. So the first one is we have our cell. So when I say extravascular, so that means outside the cell. And when I say intravascular, that means outside the cell. So remember natin yan kasi later on, masasabi ko yan siya ng mga terminologies. And then the second one is we have the homeostasis. So may I ask, Miss Domato or Mr. Domato. Hello, if you have any idea, what is homeostasis?
Pardon ko lang, naputol po yung question mo.
Okay, do you have any idea po what is homeostasis? Okay, so may nag-chat na, it is balance. So yes, that is balance. So ang ating body, guys, our students, mahilig talaga yan siya na i-balance out. So inside our cell, meron yan siyang mga fluids na nag-shift and out in order for it to maintain homeostasis or to maintain balance. And then the third one, yes, maintain stability, tama din po. And then the third one is we have osmosis. So we follow the principle from lower concentration to a higher concentration. So we will use that principle mamaya ng osmosis sa ating types of IV fluids. So next slide, please. So we have three types of IV fluids. So we have isotonic, hypotonic, and hypertonic. So first we will discuss what is isotonic. So from the root word iso, meaning equal, and tonic natin, which means concentration of solution. So if ipagsama natin yan, there is an equal concentration of solution. So for example, guys, remember natin, ito yung cell natin. And inside our cell, for lecture purposes lang, for example, sa loob ng ating cell is meron tayong apat na water and meron din tayong apat na solute. So balance siya. And then dito, we have here our bag of isotonic. So inside the bag of our isotonic, meron din tayong equal concentration of solution. So we also have 4 water and or fluid, and we also have 4 solutes. So equal siya. So now, anong mangyayari if bigyan natin ang ating body ng isotonic na solution? So ma'am, anong mangyayari sa cell natin? So when we give isotonic, wala siyang magiging effect sa ating cell. So hindi siya mag-burst or hindi siya mag-swell and hindi din siya mag-shrink. So bakit yan siya ma'am? So following the principle of osmosis from lower concentration to higher concentration. So in our uh, extravascular and intravascular natin na mga compartments, wala naman tayong higher or wala naman tayong mas higher or mas lower na concentration. So meaning same lang ang kanilang concentration and it will remain lang ang ating binigay na isotonic in the extracellular. So ang ginagawa lang niya is ini-increase niya ang volume loss. So when we say isotonic, increase niya ang kanyang extracellular fluid volume loss or primarily ginatreat niya ang ating mga fluid volume deficit. So sino ba nakaka-experience nitong mga volume loss or fluid volume deficit? So these are people who are dehydrated, merong blood loss, vomiting, and diarrhea or just came outside of the surgery. So yan sila. So remember guys, when isotonic, it just adds volume sa ating plasma. So next, hypotonic. So from the word hypo, meaning less, and then tonic, which means, again, concentration of solution. So there is a lesser concentration of solution. So again, dito guys, ang ating cell. And then dito, meron tayong bag of hypotonic. So sa bag ng ating hypotonic, sabi daw, less concentration of solution. So for example, meron tayong 4 fluids or 4 waters and meron lang tayong dalawa na solute. So anong mangyayari if ibigay natin ang hypotonic na solution sa ating body? So ito yung cell, bigay tayo. What will happen is it will yung ating mga fluid, it will shift out from the extravascular space and into the intravascular into the interstitial space. So bakit siya? Again, following the principle of osmosis from lower concentration to a higher concentration. So mas marami tayong concentration of solute inside the cell, mas marami tayong concentration inside the cell kumpara sa labas. Since nga, binigyan natin ng hypotonic, mas marami yung kanyang fluids. So yung fluids, it will shift out papunta inside. So what happens to the cell? So the cell will swell or burst. yan siya if hypotonic ang ating binibigay. Kasi ang ginagawa niya is nagpapasok siya ng fluid. So it is given itong hypotonic natin sa ating mga patients whose cell are dehydrated. Or usually ang mga conditions natin na binibigyan natin sila ng ganito is diabetic ketoacidosis and hyperglycemia. So when we are giving hypotonic, guys, we have to monitor for inflammation or infiltration sa ating IV insertion site because again nga it can cause the cell to swell or burst, and also it can deplete our circulatory system. So bakit? Kasi nga it will become hypovolemic since wala ng fluid na natira, lahat sila pumasok na sa cell. So that is our hypotonic, so meaning it will shift out from the extravascular into our interstitial space. Next is we have hypertonic, our last type. So from the word again, hyper, meaning more, and tonic, concentration of solution. So there is more concentration of solution sa ating hypertonic. So again, ito yung cell. And then meron tayo dito yung hypertonic natin na solution. So inside our hypertonic na solution, mas marami ang ating solutes kaysa sa ating water. So for example, meron tayong 4 na solute and meron lang tayong 2 na water. So what happens, ma'am, if atin yan siyang ibigay sa ating body? So lagay tayo. So following again the principle of the osmosis from lower concentration to a higher concentration. Since mas marami ang ating binigay na solute, so yung mga fluid natin inside our cell, they will shift out na naman. So from inside, lalabas sila sa ating extracellular fluid. So it has a greater concentration kasi dito sa labas. So lalabas sila. So it pulls the fluid and electrolytes from the cell and interstitial space into the extravascular space. So, bakit ito siya binibigay? So, itong mga hypertonic natin, binibigay ito siya kasi may mga patients tayo na ang kanilang cells are very swollen. So, example nito is the cerebral edema. So, by giving a hypertonic solution, hini-help niya na i-decrease ang swelling by removing fluid of the brain. So, since nga nag-transfer na lahat ng fluid outside of the cell, so ang mangyayari sa ating cell is it will shrink. So liliit siya. So monitor again natin yan siya kasi it can cause the cells to shrink. So that is our isotonic, hypotonic, and hypertonic solution. Next slide, please. So we have selected IV solutions para sa ating mga types of fluids. So for our isotonic is we have our 0.9 sodium chloride or our plain NSS. And then we also have our plain lactated ringers and 5 dextrose in water. So ma'am, bakit po? Ma'am, ano po ang isang hypo, ano po, hyperglycemia. Okay, so balik. So bakit ba naka-red yung 5% dextrose in water natin? So I will explain that later po sa next slide. So we have, next slide please. Selected IV solutions for hypotonic. So we have 0.45%, 0.33, and 0.225% of sodium chloride and 2.5% dextrose in water or our D2.5W. So dito ko i-explain. So bakit naka-red yung 5% dextrose in water natin sa isotonic? So makikita niyo siya minsan, class, na sa mga sources natin na nagsasabi na ang D5W or ating 5% dextrose in water can be isotonic and it can also be hypotonic. So bakit siya? So 'di ba sa bag natin it is isotonic. So meaning meron siyang 4 na water and then meron din siyang 4 na glucose since dextrose siya, so ang solute natin is glucose. So pag administer na natin yan sa ating body, what happens is mas i-absorb kasi ng body natin ang glucose. So mas maliit na yung mga solute niya and mas marami nang matitira na water. So that's why sometimes may mga sources tayo nagsasabi na ang D5W can also be hypotonic when it is given inside nasa ating body. So yan siya. Next po. So we have selected, next slide please. Wala pa sis, dito sa selected. Ayan, selected IV solutions for hypertonic. So we have 5% dextrose in normal saline solution or our D5-NSS, 5% dextrose in lactated ringer, 5% dextrose in 0.5 normal saline solution, and 10 to 50% dextrose in water. So next. So we have classifications of IVF solutions. So we have three. So we have nutrient, electrolyte, and we have our volume expander. So dito sa ating nutrients, guys, it contains some carbohydrates and also water. So useful ito for preventing mga dehydration. However, itong sa nutrient natin, meron siyang insufficient na mga calories. So example of this is 5% dextrose in water and 0.5% sodium chloride. So next classification is our electrolytes. So dito sa electrolytes natin, nag-contain yan siya ng mga various amount of cations and anions para i-correct ang mga imbalances sa ating body. So example, we have plain NSS, plain lactated ringers, and other ringer solutions such as sodium, chloride, potassium, and calcium. And then we have also last is our volume expanders. So ginagamit ito siya para increase ang ating blood volume following from a severe blood loss or loss of plasma. So example natin dyan is we have our dextran, which is a type example of plasma expander that is a glucose derivative. And then we also have our plasma and albumin. Ang ating albumin naman, guys, ginagamit ito siya to replace proteins. So next slide. So yan siya, examples yan siya ng ating IV fluid. So we have our plain NSS and our lactated ringer. So usually no, may mga colors yan siya, pero hindi dapat tayo lang mag-base kasi nakita natin dito sa example na ay color green yung ano niya plain NSS. So lahat din ng mga bags natin is color green, basta color green plain NSS. So we should not just base or look on the color because there are instances na sa company lang natin yan siya. So we always still need to check the label na nilalagay dyan para talaga sigurado tayo. Next. Oh. So we have types of infusion. So first is we have continuous infusion. So binibigay ito na infusion to keep the infusion running constantly until order na ng physician natin na okay, discontinue na natin ang ating IV therapy. Next is we have intermittent infusion. So from the word itself na intermittent lang siya, sometimes no ang ating mga IV lines, they are cut off with an injection port and ginagamit lang siya periodically. Next is we have bolus. So it is also sometimes called as an IV push or IVP drug. So this is injected slowly via a syringe into the IV site or sa ating tubing port. So later guys, may picture ako na ipapakita para mas ma-visualize nyo ano ba yung bolus. Next is piggyback or secondary na infusion. So usually dito mga IV medications such as antibiotics, meron tayong piggyback. So this is to infuse over a short period of time. So in order for the piggyback natin na medication to infuse, dapat mas higher siya ng height natin kaysa sa ating primary infusion. So I will show you some pictures. Next slide please. So yan siya guys, this is an example of our piggyback. So yung mas higher dyan na bag, that is our yung ating usually antibiotics. So ganyan siya. So nakakonect yan siya dito. May makita kayo dito na yung piggyback port niya. So it is connected to our primary set. Next po. So ito naman ang ating IV bolus. Next. Next po.
Nag ang net.
Okay. So we have examples of other IV infusions natin. So we have TPN or our total parental na infusion. So this is to provide nutrients para sa patient natin who do not have a function to their GI tract. And then we have blood and blood products. So this is to replace naman blood that was lost during surgery or injury. Next slide, please. Now we will go on to the site of IV therapy. So we have some considerations sa ating site of IV therapy. Next slide, please. So consider natin ang client's age, the length of time, type of solution na ginagamit natin, and condition sa ating vein. So we have to keep this in mind before man tayo pipili ng site sa ating IV therapies. Next po. So we have common peripheral sites for our IV therapy. So we have our inner arm. So dito yan siya. So usually, makikita natin to sa mga blood transfusion. So usually dyan yan ang site niya. For dorsal surface of hand, dito sa likod, and dorsal surface of the foot. Next slide, please. So, vein selection guidelines. So, ano ba itong mga guidelines natin? So, please use daw na distal veins of the arms first since this is also common ito siya na ginagamit natin na sites. So, this are example ay sa dorsal metacarpal natin since yung veins niya is much larger and easier to see and IVs na inserted dito sa ating mga distal veins are easily splinted and any infiltration, madali lang natin siyang ma-spot. So these veins are the preferred site natin. And then use the non-dominant hand whenever possible and avoid using veins that are located at areas of flexion, highly visible, continually distended, damaged by previous IV access, or surgically compromised or injured extremity.
So good afternoon, everyone. So I am going to discuss the intravenous devices. So next slide, please. So first, we have the butterfly needle. So the butterfly needle, it is a small gauge needle used to deliver small quantities of medicine to administer fluids via the scalp of infants. Ginagamit ito sa scalp ng infants to secure access to secure the intravenous access in neonates and the infants. Kasi often, after the unsuccessful attempts na cannulation sa upper and the lower limbs of the veins, wala na silang other makita, gina-consider na nila yung veins sa scalp ng infant. Also, to draw blood samples. So, next slide, please. Next is we have the IV cannula. So the IV cannula is also known as over-the-needle catheter. So as you can see in the pictures, we have the different colors and sizes of the IV cannulas. And the higher the gauge number, the smaller the cannula. So it is used for fluid administration, administration of medications, intravenous nutritional support, repeated blood sampling, and administration of blood products. So it is indicated for dehydration, malnutrition, or nutrient replacement, surgery, medication administration, as well as emergency situation. Meron din itong contraindication like yung mga patient na may massive edema sa kanilang extremities, burns, or injury. Also, yung mga patient na may cellulitis na located sa kanilang extremities. Kasi when starting IV in the area of infection, we should avoid starting IV in the area of infection because of the risk of manipulating the circulation with bacteria. And also contraindicated din siya sa patient na may severe water retention. So next slide, please. So this is the table. You can see the different sizes, the color, and its flow rate. and the recommended uses. So the common gauge na makita sa hospital is the purple, which is the 26 gauge, the yellow, which is the 24 gauge, and the blue, 22 gauge, and the pink with 20 gauge, also the green one with 18 gauge. So for the IV cannula size, ginagamit ito yung 14 gauge, which is the orange. It has a flow rate of 240 and it is recommended use for the trauma, rapid blood transfusion, and for surgery. Next is for the 18 gauge, 16 gauge, which is the gray one. The flow rate is gauge. Sorry, gauge.
Yes,
Oh my God.
gauge.
Gauge pa. So, sa 16 gauge, which is the gray one, it has a flow rate of 180 and it is used for rapid fluid replacement for trauma patient and rapid blood transfusion. So for the green one, which is the 18 gauge, it has a flow rate of 90 and it is used for rapid fluid replacement, trauma, rapid blood transfusion. For the pink one, which is 20 gauge, it has a 60 flow rate and it is most used for infusions, rapid blood replacement, trauma, and also for routine blood transfusion. For the blue one, which is the 22 gauge, it has a 36 flow rate and mostly ginagamit siya for infusion, neonate, pediatric, older adults, and routine blood transfusion. For the yellow one with a 24 gauge, it has a flow rate of 20 and mostly ginagamit siya for infusion, neonate, pediatrics, older adults, routine blood transfusion, neonates, or pediatric blood transfusion. For the purple, it has a 28 gauge with a 13 flow rate and ginagamit ito ng mga pediatric and neonates. Next slide, please. So for the infusion set, so we have the IV tubing. So we have two different types of IV tubing. We have the macro set and the micro set. So yung macro drip or the macro set delivers 1 cc of IV fluid at 10, 15, or 20 GTT per minute. So ginagamit ito for faster fluid infusion, pero mataas ang risk na magka-fluid overload ang patient. So, yes. So for the microset, it has a small needle connecting to the spike and the drip chamber, and it delivers 1 cc of IV fluids at 60 Gbps per minute. So mas easier siya i-regulate and mas lesser ang risk of overload, and also easy siya i-titrate. And pero bawal siya, di siya gina-allow for resuscitation and fluid boluses. Next slide, please. So, as you can see in the picture, yung macroset is wala siyang needle compare sa micro drip. So, usually ginagamit ang macro drip for the adults and for the pediatric yung micro drip. Next slide, please. So next is we have the intravenous devices. So first we have the measured volume set. So the measured volume set is an infusion set with an inline of 150 cc capacity volumetric chamber or burette type chamber. So it delivers specifically measured volumes, burette sets, and dial flow sets. It has a safety flow valve to prevent the backflow of blood once the infusion done. So next is we have the electromechanical infusion device. So the electromechanical infusion device is also known as the infusion pump, and it accurately controls the rate of the infusion, especially when magbigay ng medication. So next.
Okay, so good afternoon, everyone. Let us now talk about starting an intravenous infusion. So, in starting the intravenous infusion, so we have to first gather our equipment. So, the equipments that we need includes an IV tray containing the following. So, the IV solution as ordered, IV tubing, needle, tourniquet, as antiseptic swab or the CB soap in ROH, plaster and masking tape for the label, arm board if needed, scissors, medicine ticket, IVF label, as well as the IV stand. Next slide, please. So now let's talk about the procedure on starting an intravenous infusion. So first, in starting the IV infusion is we have to make sure to check the IV solution and the medication additives with the physician's order. So this is like the first step in initiating an IV. So first is to check the physician's order and confirm the identity of the patient. So compare the medicine ticket with what is written on the medical order sheet. So we are doing this like checking the both the medication ticket because we wouldn't want to give our the wrong medicine to the patient or give the right medicine to the wrong patient. So we really have to ensure that we have the right patient as well as the right drug. Next is we have to wash our hands. So always washing our hands is really have to do the washing of hands because um, we are performing a medical procedure. So our goal there is to deter the spread of the microorganisms na pwede soon makakomplicate sa atuang patient. So next, gather all the equipments and prepare the IV solution and tubing. So as a student nurse or nurse on the ward, so we are really doing our like procedure as efficient as possible. So next, so for the priming, priming is priming is done prior to connecting the IV tube to the patient. So the IV fluid must be primed into the IV tubing to remove the air. So the purpose to that is to prevent the air from flowing into the circulatory system. So next slide, please. Now, how do we prime? So next slide, please. In performing the priming, we have to first maintain the aseptic technique. So when opening our sterile packages and the IV solution. So in this procedure, we are using sterile packages. So like the tubings, they are sterile. So this will prevent the contamination of the IV solution and the set that we are going to use, which can infect rapidly to the patient. So these complications may arise from not following the right aseptic technique. Next, clamp the tubing. So as you can see in the picture, the blue, the clamp. So we're going to uh, clamp the tubing so that if ma spike na natin yung needle ng tube sa ating bottle is that dili siya mag-awas good sa ano ba yun, sa tubing. So after that, uncap the spike and insert it into the entry site on the bag or the bottles at the manufacturer's direct. So if additive is ordered, i-incorporate na natin to siya bago i-spike yung sa tubing. So next slide please. So next is suspend the IV solution on a hook in the preparation area and press the drip chamber and allow it to fill at least halfway. So as you can see sa top na picture, imo na siyang i-press hantod sa ma-fill ang tube sa patunga lang na water ma-fill lang siya kanang naman na siya line. So hanggang diyan yung water niya. So this suction effect causes the fluids to move into the drip and the drip chamber and also prevents the air from moving down the tubing. Next is to remove the cap at the end of the tubing and then pabalik. So remove the cap. So kaning sa baba na picture is imo na siya ang sa tumoy sa imong tubing. So imo na siyang i-remove ang cap para if magpalabas ta sa bubbles later on is mas dali na lang siya. So remove the cap at the end of the tubing and then release the clamp to allow the fluid to move through the tubing. So this now is termed as priming the tubing. So allow the fluid to flow until all the air bubbles have disappeared and close the clamp after removing all the bubbles and recap the end of the tubing, maintaining sterility of the setup. So after mong mapalabas yung bubbles is i-cap man mo siya na. So after ato imo siyang i-place dito as a roller kasi may lagayan siya doon para dili siya matouch sa other places na contaminated na mga contaminated na places. So diyan mo siya i-secure. So next slide please.
So now, next is assisting. So as student nurses, no, our job sa ating IV therapy is to assist. So ina-assist natin either kung sino yung magi-insert ng IV, so it can be the physician or it can be the nurse. So before pa man tayo na um, before tayo, for example, na-prepare na natin yung mga equipments na sinabi kanina, so we will notify the physician or yung nurse na mag-insert ng IV. So pag dumating na siya, we have to bring all the preparation to the bedside, yung na-prime na natin na IV tube and other equipments na kailangan natin. So we will help or position our patient in a supine or low Fowler's position in bed depending on anong mas komportable sa kanila. And yung gawin natin during the IV insertion is you are going to hand the tourniquet sa mag-i-insert either again doctor or nurse, followed by naka-ready na yan siya sa atin para diretso na mabigay ang ating cotton balls with alcohol and yung needle na gagamitin. And then once na na-insert na, we release the tourniquet when meron ng backflow or return flow of blood to the adapter if is observed. So, ito siya naman na part, it is optional kasi meron din tayong mga doctors or nurses na sila na yung nag-remove ng ating tourniquet. Next.
So for the discontinuing unintervened IVF, so when the patient is no longer need IVF fluid, so the IV medication or access for emergency drug, the cannula is already removed. So the standard precaution must be followed when removing an IV cannula because there is almost always a slight amount of bleeding that occurs. So make sure natin na gina-check mo ang physician order for discontinuing the IVF. So dili lang ka magpataka-taka o discontinue para ma-prevent din natin ang discontinuing the IV and having to restart it again. And also, dapat alam natin ang movement na pang-remove kasi ang movement of the needle kay maka-injure siya sa vein and mag-cause pa siya ng discomfort sa ating patient since mayroong counter actions prevent pulling the skin that can cause discomfort. So for the next is
So in this continuing and intravenous infusion, so first we have implications. So the patient's oral fluid intake and hydration status are satisfactory so that no further IV solutions are ordered. So of course, before you discontinue the infusion, make sure or double check the physician's orders. Next is there is a problem with the infusion that cannot be fixed. So infiltrations occur when fluid leaks out of the vein into the surrounding soft tissue. So the common signs include inflammation, tightness of the skin, and pain around the IV site. Next is the medications administered by IV are no longer required. So most probably the patient is already for discharge. So for the KSS or the keep set sterile, so discard the needle and make use of the cover of the tubing. Then attach it to the regulator or make use of a plaster and attach it to the tubing. So after discontinuing the IV therapy, so the patient is either for discharge or for KSS. So for the KSS, discard the needle and make use of the cover of the tubing if it is still available. So if there is no cover for the tubing anymore, you can utilize a syringe cover to keep the set sterile. So again, attach it to the regulator or make use of a plaster and attach it to the tubings.
So now for the Ipf regulation formulas, we have the rate and the duration. Next slide, please. So we have a factors that considered in regulating in an flow. So we have the flow rate or the speed and the duration of administration or the time. Slide. Next slide, please. So we have na-discuss kanina na may dalawang two types of drop factor, which is the macroset and the microset. The macroset is 15 to 20 GTPS, or we can check the manufacturer's direction, and the microset, which is the 60 GTPS per ml. So the macroset is used for adults, and for the microset is used for pediatrics. Next slide, please. So we have the flow rate. So the number of drops a patient receives over the determined time. So we have the formula rate equals the total volume or ml times the drop factor, which is the GPPS per ml, divide the duration or the hours times 60 minutes or hour. So 60 minutes is constant na siya since 1 hour is equals to 60 minutes. So next slide, please. So I have example here. So PNSS 1 liter to run for 10 hours using macro infusion set or the 20 GTPS per ml. So rate, ito yung formula kanina. So rate is equal to total volume or ml times the drop factor or the GTPS, divide the duration of hours, then times siya sa 60 minutes. So rate is equals to 1 liter. 1 liter is 1,000 ma-convert siya into 1,000 ml times the 20 GTPS, the drop factor, since macro man siya, and then divide siya sa 10 hours, kasi to run for 10 hours daw siya, and then times 60 minutes. 60 minutes kay constant dito siya. So equals 1,000 times 20 GTPS is equals to, hindi ko maka-annotate, sorry. So 1,000 times 20 is equals to 20,000. And then wala na siyang ml since na-cross out na siya. So GTPS, divide the 600. So ang 600 equals siya sa 10 times 60. So equals 600 minutes per hour. So 20,000 divide the 600 is equals to 33.3 or 33 GTTS. Since in writing the answer for flow rate or GTTS per minute, we should not use decimal places. Instead, we can round up. For example, 23.81 GTT per minute, magiging 24 siya since lagpas siya 5 yung decimal point. Then, pwede rin siyang i-run down. For example, ito, 33.3, magiging 33 lang siya since di siya nakaabot ng 0.5 yung decimal. And then, pwede rin siya for ranges na, for example, 41.67, pwede siyang gawin 41 to 42 GTTS per minute. So, next example. So, next is we have the PLR 1 liter to run for 15 hours using microinfusion set or the 60 GTTS per ml. So, same formula, rate is equals to volume or the ml times the draft factor, which is the microset, and then divide siya sa duration or the hours, then times 60 minutes per hour. So rate is, since 1 liter man ang bigay, so 1,000 ml siya. And then for the draft factor, we have the microinfusion set which is the 60 GTTS per ml. And then divide siya for 15 hours, then times 60. So we have 1,000 ml times 60 is equals to 60,000. And then divide siya sa 15 hours times 60, which is the 900 minutes per hour. So we have the 66 GTTS.
Miss Ortiz,
Yes po, ma'am.
do not read as GTTS ha, that is drops.
Drops
Per
po.
minute. Oh, okay, masanay kayo niyan.
Sorry po, ma'am. So, yun. Di po ako maka-annotate. Okay lang po. So, next is we have, next slide, please. We have the duration. So, the total expected time the IVF will be infusing per hour. So, the duration, ito yung formula niya. Duration equals to total volume or the ml divide the time or the hour. Next slide, please. So, here is the example for the duration. A patient is receiving 1 liter normal saline IV to run for 8 hours. Compute the amount of IVF expected to be complete per hour. So, the formula is duration equals total volume or the ml divide the time, which is the hour. So, yung gibigay is 1 liter normal saline. So, we have 1,000 ml divide 8 hours is equals to 100 ml per hour. So, we have here, next slide please, exercise. So, I want everyone to get a piece of paper and a ball pen para I-solve yung exercise. And then raise hand lang sa gusto magsagot. So may nagsagot sa chat box. So yung number 1, the doctor ordered 1 liter lactated ringers to infuse over 8 hours. You have a microdrip tubing with a drop factor of 15, macrodrip 15 drop factor, and calculate how many drop factor to set the IV flow rate. So yung sagot niya is nila, marami sila, 31 GTTS per minute, which is tama. Tama siya. Di talaga ako maka-annotate. Gusto ko mag-solve sa screen. And then sa number 2, nagsagot din sila 83 ml per hour, which is correct din po. So a physician ordered 1 liter PLR to run for 12 hours and compute the amount of IVF expected to be complete per hour.
Yes. Excuse me, Artist. So the answer for exercise number 1 is 31.25.
25. Yes po. Then,
So,
di siya pwede mag-decimal.
how you
31
will
lang po.
regulate that 31.25? Kung i-regulate mo yan siya by yung kanyang tulo. Okay, you teach the level 2. Sige. So natin yan siya anong tawag nito? Anong ang term nun?
Round off po.
Round off. Okay, a round off. So, tama ba ko, Ma'am Flo? So, 31.25, i-round off na to og 31 to 32 or 30 na lang?
Sa to, Ma'am Alma, 31.25?
31.25, Ma'am Jex.
O di
So,
na
kung
sa 31.
31 lang, no? O, wala na ng 0.25. So, imo gyud ang i-count ng 31, no? In one whole minute. So, it's okay if we will be using the IBF pump. Kato ganing i-attach natin sa machine. And then, ang machine na ang anyway, you'll see that no during sa inyong RLE duty. Pero kung i-count, 31 na lang, ayun na doon 25. Sige, ang next, anong answer niyan?
83 po. 83 ml per minute.
83 ml. Oo.
Yes po.
Okay. Sige, thank you. So 83 ml, dali lang, nag-apil-apil gid si ma'am, no? 83 ml per hour. And then how many drops per minute? If i-convert mo yan into drops per minute po. Drops yun yung GTTS. Bisura po na i-pronounce yung GTTS. Drops. So ilang siya, ilang drops kung i-regulate mo yan. It's okay kung mayroong yung anong tawag yun, Ma'am Florence, yung machine, infusion pump, infusion pump. Kay imo lang man ang ding dito, niya i-set ni mo 83. Oo, pero kung walang not all not all, especially sa SPMC, no, lang maihap only the ICUs ang merong infusion pump, no, each patient, but in the ward, gyud siya kanang say tawag ani, wala jud ihapon gyud na sa nurses, no. It's good kung may student nurses. Pero Ma'am Flo, naitawag atong katuganing regulator.
IV regulator.
Oo, katuganing na imurag ikuan nimo, ilak nimo. Oo, lawa mo gagamit pila to uy.
Di kana sa tubing siya, ma'am, sa tubing.
Oo, sa tubing.
Roller clamp?
Yes.
Roller clamp?
Roller clamp.
Yun siya, Ma'am Jack.
Not all of the tubings na ay mag-roller. Ay,
Oo.
di roller clamp. Napod tong katong pang ma'am na regulator na 100 cc per hour. Aside sa napod to cc per hour. Pero nakatouch siya sa tubings lang. Pero di tanan depende sa manufacturer sa IVF. But then katong infusion pump ang gina-regulate sa student, katong infusion, katong roller clamp ang gina-regulate ni student.
Diretso na to siya. Pero kung mag-manual ta, students, kung tayo talaga ang mag-count niyan using our second hand sa atong wristwatch, sige. Ilan ba yung 83 ml or 83 cc per hour? So ilang drops siya per minute? You solved. Pila siya, bungkig na pod. Sige, answer. Wala, ako na may nag-PCI.
Sorry po, ma'am.
Sige daw, basig na yung answer ang level 2. Kung sa ilang answer?
20 daw sa kanila, 1.30 naman.
Tama, sa inyong computation, PCI.
1.38, ma'am.
Drops?
I drop.
Tanawa inyong answer key. Saan ang inyong answer, mga answer key dyan? Kuha na? We'll proceed na sa next exercise. May INO pa pala, ma'am. Ilan, Miss Ortiz?
Okay, wala. Pero 115?
Nagdako na noon. Drops lang.
Drops?
Drops lang man. Asa man ang formula, ana?
Wala po akong copy sa formula, ma'am. Sorry po.
Sige. Ang bakisa na ha. So, ang answer ng level 2, ilan yun? 20 drops per minute. Sige, next na. Sige, isolve sana bago ninyo isultig. Tama ba to ilang answer or dili? Kuha asa to. Sige. Okay, next na.
So for the factor that affects the flow rate. So first we have here flow is directly proportional to the height of the liquid column. So meaning if the IV stand is high, ganun din kabilis ang flow. So if mababa din, so mababa din yung flow ng IV mo. So if masyadong mataas ang gravity, it would really pull, so mabilis ang flow, masyado namang mababa, din gaano kabilis yung flow. And the next is, flow is directly proportional to the diameter of the tubing. Yes, if malaki ang tubing, mas mabilis, and if maliit ang diameter, mahina din yung rate. And the next is, flow rate is inversely proportional to the length of tubing. So inversely proportion, meaning to say kung mahaba ang tubing ng IV, then syempre matagal din ang flow rate. Then if maiksi, madali lang din yung flow rate niya. And the next is, flow is inversely proportional to the viscosity of the fluid. So if it is highly viscous or yung masyado thick, maghina siya kaysa katong dili thick, mas mabilis siya. And then next is the other factors affecting the flow rate. So first we have our age, and then the condition of the patient. syempre, di pwede bilisan for the patients na mga old and very young, then depende rin yan sa condition ng patient. So if the patient has a problem sa kanilang lungs or in the heart, di mo rin pwede mabilis yung flow rate. And then next is we have our solution use. So if the patient use a dextrose, nag-combine siya with, for example, i-combine siya with potassium chloride. So hindi nyo siya pwede i-fast drip ang dextrose, or otherwise, what will happen, meron yung mga complication and it will cause extravasation. And the next is for the manufactured drug factor. So if 10 lang ang factor, then simple as 10 din siya. Kung ano yung nakalagay, yun lang talaga yun. So that's why important talaga na i-read yung instruction. The next is
Next is we have the patency of the needle. So to check for the patency, the nurse inserts a syringe filled with saline solution, so which is a mixture of salt and water into the cannula. Next is the position of the site. So the position, the needle point or the bevel up parallel to the vein and about 1.5 inch below the site of the venipuncture. So hold the needle at 20 to 30 degree angle and pierce the skin. So if mali ang pagka-angle nyo, it can affect the flow rate of the infusion. Next is the height of the IV pole. So this provides a secure place to hang bags or of medicine or fluids of administration to the patient. So we need gravity so that mas efficient ang flow rate ng infusion. Next is the kinking of the tube. So this is done to make sure that the air is not trapped inside the tubing and to ensure smooth flow of the fluids.
So next, let's talk about the common complications of the intravenous therapy. So next slide, please. So I would like to ask anyone here, is intravenous devices susceptible to infectious complications? What do you think? Misconception? Do you think intravenous devices are susceptible to infectious complications? Just
Yes po, ma'am.
Okay, very good. So yeah, intravenous devices are really susceptible to infectious complications because bacteria can migrate into the bloodstream from our skin along with the cannula. So from the hub or the side port of the cannula and from the contaminated IV fluid. So this is an example. So this is the picture of in an infected area. So next slide, please. And here are the signs and symptoms of infection. First, we have the redness, swelling, and the drainage at the IV site. So next, for the nursing management, we have here the strict aseptic technique. So the insertion of this IV cannula should be considered as a minor surgical procedure that is carried out with a high standard of asepsis because this is like a way to protect our patients from those harmful bacteria and other pathogens during the procedure. Next, we have monitor signs of systemic infection. So this is to be monitored because it can be a sign of infections in the bloodstream, which most common cause niya is like sepsis. So next, discontinue the IV. So discontinuing the IV is done if the IV site becomes unfavorable due to the infection. That is why nurses or student nurses should be observant and like frequently check the IV line and site to address if there are or there is an infection and to further or to prevent the further complications. Next, we have next complication is the infiltration. So infiltration is when a non-vesicant solution or medication enters the surrounding subcutaneous tissue. So small infiltrations of this non-vesicant medication happens frequently with no negative outcomes to the patient. So this solution or medication are absorbed by the blood vessels over time. However, those large infiltrations can cause compartment syndrome. So this compartment syndrome occurs when there is like pressure na nag-arise siya in around sa mga muscle air sa atong muscles. So the pressure is very painful. So sakit gid kay siya samot nagkanang ano na grabe na gid ang pressure. So um also it can also be dangerous. So this will then requires an emergent fasciotomy to relieve the swelling and the pressure. So if not recognized and treated promptly and properly, the patient may be left with a permanent nerve injury, severe scarring, and reduced functional capacity of the extremity. So next, here are or here there this is the underlying cause. So the cannula dislodgement or perforation of wall of the vein. So this can be a cause of or caused by improper placement or dislodgement of the catheter. So additionally, patient movement can also cause the catheter to slip out or through the blood vessel lumen. So here are the signs and symptoms of the infiltration. So first you have the leakage of the IV fluid. So this may indicate that the catheter is dislodged or the needle penetrating through the vein. That is why you can see a leakage on the IV side. So next, discomfort. Fluid flow becomes slow or ceased, and sometimes there is an absence of um, blood backflow. So next, we have the nursing management. So first, stop the infusion and remove the cannula. Elevate the elevate the limb. Apply warm or cold compressors. So if elevating the catheter helps, a small piece of gauze may be placed under the needle para mag-hold lang siya into position. Pero if it does not correct the flow of the infiltration, stop the infusion na and notify your supervisor. So you can also use a cold pack to help reduce the swelling and the pain. So next is using of appropriate size and type of cannula and good fixation technique prevents this problem. Okay, next for the third common complication. Next slide, please. So we have the extravasation. So it is like similar to the infiltration with an adverent administration of vesicant solution or medication into the surrounding tissue that leads to blisters, inflammation, necrosis of the tissue. So the difference between the extravasation and the infiltration is that the the extravasation is like the vesicant and the non-vesicant solution is the non-vesicant solution can cause the tissues causes tissue destruction or blistering, while yung non vesicant is dili niya ma-irritate ang skin. So mo to ang difference nila. So next, for the signs and symptoms, similar lang din sa infiltration. So there is fluid leaks out of the vein into the surrounding tissue. So similar lang sila sa infiltration. So next, for the nursing management, usage of the antidote. So according to policy, throughout the neurovascular assessment of the affected extremity must be performed frequently. So there are mga effective na medications na nag-serve as antidote which could be used in accordance to the policy din sa hospital policy. So it is also important to continue observing the area post-extravasation injury to ensure na there are no signs of infection or further complications. Okay, next slide, please. So for the last complication, we have the phlebitis. So it is the inflammation of vein related to a chemical or mechanical irritation, or it could be both. So there is a development of these inflammatory changes in the vessel wall and tissues surrounding the site of the insertion of an intravenous infusion catheter. So here is the underlying cause of phlebitis. Next slide, please. So the risk of um, phlebitis increases with the length of time IV line is in place, site of cannula inserted, microorganisms at the time of insertion. So these are the factors contributing to the instances of developing this phlebitis, especially if we fail to monitor the early signs and symptoms. So here are the signs and symptoms of phlebitis. Next slide, please. First, we have the redness, warm area, pain, and the tenderness. Okay, for the nursing management, so discontinue the IV and apply cold compressors. So later on, you can use the warm compressor na and then keep the site elevated. So this cold pack will help reduce the pain and the swelling. So next, to avoid phlebitis, use strict aseptic technique. Rotate IV site every 72 hours as per policy or as needed, and daily dress the site or as needed. Next slide, please. So this is an example of IV documentation. So first, indicate the date and the time of the IV administration. So August 18, 2022 at 8:30 a.m. So for the nurse's note, indicate the solution given and the volume, the incorporation, the name of the physician, the nurse or the physician who performed the procedure, the site, the drops per minute, and lastly, your assessment after the procedure. So if there are adverse reactions such as mga swelling or redness, imo na siyang i-indicate tira sa nurse's notes. Then, name of the person who performed the procedure on the bottom.
So now we are going to talk about our intake and output. So what is intake and output? So first, intake and output is the measurement and recording of all fluid intake and output within 24 hours period. This provide a significant data regarding the client fluid and electrolyte balance. So ang purpose talaga ng collecting the intake and output is para ma-evaluate. So as student nurse, kailangan natin i-collect every few hours or maybe only once a shift, whether that's 8 hours or 12 hours. Normally, the amount of total body water, kailangan siya mabalance through the ingestion and elimination of water. So, yung pagpasok and yung paglabas. So, to ensure this balance, as nurses, need natin i-track and i-record lahat ng fluid intake and output on the intake and output sheet, commonly known as I&O sheet, which will be explained later. And the next is we have to measure in ml. So, merong conversion talaga na dapat into ml siya. And then, pwede din siya matawag na cc. And then next is, why is I&O monitoring important? So first is to ensure an accurate assessment record. So di ba if mag-vital signs ta sa atong patient, ginaas na to sila na, ma'am, sir, nakaihi na ba ka? Ikapila ka naglibang karon or ikapila ka nag-ihi? Ma'am, pila ka baso imong nainom na water karon, ma'am? So i-take note jud na to na all the time kay para makabalota if enough na ba ang intake sa atong patient or nasobraan pud ba sila sa output sa atong patient. And then next is to ensure the client has a proper intake of fluid and nutrients and determine if there is normal defecation and urine output para to assess the renal function. So This is particular important for the patient who have mga special orders such as may mga restrict fluids and encourage fluids. So client who are at risk of fluid volume excess which may affect the normal body function. So wherein mayroong edema can take place. So client who are at risk for fluid volume deficit may also have an adequate intake of fluid in a day or can be losing of great amount of fluid due to the medication like mga diuretics, vomiting, diarrhea, bleeding, sweating, or fever. And the next is this is to help in diagnosis and treatment of the client. So that's why monitoring is a vital step in clinical care because nag-provide ng means to determine the progress of the disease. So as nurses, kailangan natin i-ensure that the patient is getting the right amount of fluid and other nutrients by monitoring the patient intake and also monitoring the output enables one to ascertain whether normal ba yung kanyang tae and sufficient ba yung urine output are occurring. And the next is to monitor the progress or effectiveness of the treatment or disorder. And also, this is to prevent fluid and electrolyte imbalance. So that's why importante jud ang pag-monitor sa atong patient sa INO. And the next is how to calculate intake and output. So what are the specific that would you include in the intake calculation versus the output since there are mayroong ibang may times na little bit confusing on what you should include. So when you say intake, this include fluid take in the body can be via mouth, tube, or IV. So pwede ba kayo mag-chat sa chat box kung ano yung mga fluid intake na included dito? Chat na kayo sa chat box. If you have any idea, what are the fluid intake ng ating patient? And me? Yes, may na-answer ng water. Yes, right. Juice, yes. Mga soda, yes. Coffee, it's included. Soup, juice, beverages. Okay, that's it. So, yes, tama kayo. Of course, salad din dyan yung mga ice cream, frozen treats like popsicle. And also, di ba, most especially, nagabigay din tayo sa ating patient ng ice chips. So, itong ice chips are liquid at room temperature. However, if let's say may 8 ounce of ice chip ka, so pag ilagay mo sa cup yung ice chips, mag-melt siya, it's only gonna be 4 ounces. So, only be half the volume kasi if mag-melt into the cup, you've got all the airspace with your ice chips, diba? So, once na mag-melt siya, wala na siyang, you don't have any of that airspace. And now, half volume na lang siya. Since nag-melt naman siya, half volume na yan siya. So, for example, so you give them 8 ounce of ice chip and then ang i-record mo sa INO sheet mo, ilagay mo doon is 4 ounce because it can melt down naman. So, i-divide by 2 nyo lang siya. And then, others are include tube feeding and any types of IV fluid like yung gipang sabi nila kanina, the TPN, the lipids, blood product, med infusion, then also the IV flushes, and then also the irrigants like yung mga continuous bladder irrigation. And then fluids that come out of the body. So ito naman yung ginatawag natin na output. So when we say insatiable loss, ito yung sila ang hindi easily gina-measured. Like for example, loss from sweating and evaporation. Also included din dito sa output nyo ang mga urine, drainage, vomitus, bleeding, and stool. And then next is, so this is the instrument. So anyone knows kung para saan tong urinals, kung asa siyang ginagamit. Chat lang kayo sa chat box if alam niyo yung answer. Does anyone know? Urine? Yes. Saan galing na urine? Kanino siya galing? Urine, yes. Ay nag-answer na urine for male. So this is to collect the urine of male, and then easy lang ito kasi meron yung urinals ay meron na daan yan siyang mga measurement. Unlike dito, of course, we have here the bedpan. Ang bedpan, ito naman yung ginagamit na sa mga babae. And as you can see, dili man siya jud ma-measure. So ang ginabuhat ana, ang ginabuhat ana kay ginabutang na siya sa cylinder. Katong cylinder na to kay na siya yung mga measurement. So dito mo magtan-aw para makabalo mo if pila ang output sa urine sa atong patient. And then also, meron tayong dito na septus syringe. This is, ginayuse ito siya feeding the client so that ginayuse ito siya for the feeding sa client. And then, itong septus syringe, meron na din yan siyang measurement. So, malalaman mo agad kung ilan yung papasok ng fluid sa ating client or ilan yung intake ng ating client. And then, here we have our kidney basin. Does anyone know kung for what ang kidney basin? Bakit siya included sa instruments sa ating intake and output? Does anyone have an idea kung for what yun? Yeah, tama. Yes, it's for the vomitus. So, ginayuse ito siya for the vomitus. And then, same lang sa sa bedpan, gina-measure din ata ang vomitus sa cylinder para maalam natin if ilan na ang gisukan ng ating patient. And then lastly is our urobag or the urine bag. So dito nagalabas yung urine ng patient if nakakatheter yung ating patient. And then meron din ito siyang mga measurements so makita mo agad. Pero para sa know kay dili daw kaayo accurate ang measurement ng urobag. So sometimes po daw ginabuhat nila kay ginabalhin lang gyapon nila sa kanang murag cylinder. And then next, you have here. Next.
So for the percentage of water in a human body, so as a person ages, maglasan din ang water percentage sa human body. So ang purpose ng water in a human body is it is the main components of most cells. It is necessary for growth and reproduction. It also aids in digestion, helps deliver oxygen, regulates the temperature, acts as shock absorber, lubricates the joints, keeps membranes moist, flushes body waste, and used to make hormones and neurotransmitters. Next, please. So here is the example for the INO sheet. So can I ask anyone if sa tingin nyo, what is the color used for the 11 to 7 shift? Anyone, guys?
Red po.
Red.
Red. Okay, for the 7 to 3.
Yeah.
Okay.
Black.
Isa, 3 to 11.
Blue.
Okay, very good. Next po. Next, Jens. So here are the conversions of sa mga household measurements. So usually ang gina-use sa SPH is or likely to sa San Pedro is the cc or the ml. So 1 cc is equivalent to 1 ml. So 1 liter is equal to 1,000 milliliters. So yan, ma-gets man yan. So, ito lang ang dapat nyo hindi kalimutan talaga. So, ice chips, if intake is 8 ounce, divide it by half. So, if ng ice chips, ma-divide siya into 2. Okay, next. So, if the output is greater than the intake, so at risk for dehydration. So, can I ask anyone what are the signs and symptoms of dehydration? Anyone? Yes, sunken eyes. Mm, opo. So, yeah, dry skin, thirsty. Yes, ang answers nyo. So next is if the intake is greater than the output, at risk po siya sa fluid overload or the fluid volume excess. So what are the signs of fluid volume excess? Edema. Tama. Swelling. Yes, pinaka-common talaga ang edema. So, other than edema, we have, sige, kung sa edema, what are the common sites of edema ba? Yes, lower extremities. So, we have the feet, ankles, wrist, and face. So, common din ang discomfort in the body. So, it causes cramping, headaches, stomach bloating, and high blood pressure caused by excess fluid in the bloodstream. Next po. Next pa, Jess. So, ito ang example ng intake and output sheet. So, same lang if ever nandito ka na shift sa 11 to 7, you have to write all your inputs in red, then black, then blue. Tapos yung total is if what shift ka galing. So like here, i-add nyo lang yan lahat. So you have the intake for the parenteral, you have the oral, and for the urine. So maglagay din tayo ng signature natin dito and your name. Next, Jess.
So, exercise lang ito siya, guys. So, for the number one, sign ka, the patient's IV of 1 liter was started at 7 a.m. It ran out at 1 p.m. and was immediately replaced. By 3 p.m., the new IV level of the new 1 liter IV was 700 cc. So upon the endorsement to the next shift, how much was the total intake for the day shift? Sige guys, try nyo solve and then answer nyo lang sa chat box. Kung may kayo, PM nyo na lang. I give you mga 2 minutes or 1 minute kaya. Yes. Nakuha na ng isang answer. Isa pa lang nag-chat sa akin. So, kaya lang dahil siya